We have here the lateral femoral cutaneous nerve. This is a visual mnemonic for USMLE Step 1. And this mnemonic storyline would call the lateral femoral cutaneous nerve lazy, fat, and cute clothing. Let's get started. This storyline revolves around this person who seems to be very lazy and definitely very fat, but they're wearing really nice clothing, so cute clothing. So it's the LFC, lazy, fat, and cute clothing. The first thing that I'm gonna notice here is the shirt, the very cute shirt right here, which writes out L2 to L3. So that'll be obviously the nerve roots, L2 to L3 of the lateral femoral cutaneous nerve. And then the second thing that we're gonna realize is that that lazy character is laying down on their side, and they seem to lay there on their side forever. So why are they laying on their side? Because that's going to represent the lateral thigh, so which is the area innervated by the lateral femoral cutaneous nerve. And because they're lazy, so they're just laying on their side all day. And actually the lateral femoral cutaneous nerve innervates the lateral anterior portion of our thigh. So it's the anterior and the lateral thigh, anterior lateral thigh. And because that fat guy is not able to move, they seem to have been stuck there forever. That would just remind us that this is a sensory nerve. It's only a sensory innervation of the nerve, and because that person is lazy, they're not moving, that would just represent that it's not a motor nerve, only it's pure sensory nerve. So it's a pure sensory nerve to where exactly? The lateral thigh and the anterior portion of the thigh. So sensory innervation only. Now the third part that we're going to talk about is the causes of injury. The most obvious one is the character thinking to themselves, am I pregnant? So pregnancy is a cause of injury, so this is number one. And then number two, you're going to think is that if you're pregnant, what can you get? A C-section. What is a C-section? It's a pelvic surgery. So the second cause of injury would be pelvic surgery. The third cause of injury would be, well, a very obvious thing that we see here is that person is obese. And what are they wearing? Tight clothing. So tight clothing and obesity is also a cause of injury. So if I tell you, guys, what are the causes of injury? Well, we have number one, pregnancy. Number two, what can you get after pregnancy? Pelvic surgery. Number three, what is that person? Obese. Number four, what are they wearing? Tight clothing. So 4 causes of injury. Great. The last thing that I want to talk about is like the presentation. How do you think that nerve's going to present? Either they'll tell you decreased thigh sensation in the lateral and anterior thigh. And number two is a very obvious thing here is the compression. Compression of the what? Of the inguinal ligament. Why do we have compression of the inguinal ligament? That's probably because of the tight clothing around the waist and around the thigh. So if you wear tight clothing around the waist and the thigh for a while, then you're going to compress your inguinal ligament. And if that happens, it's going to lead to a high yield condition known as meralgia paresthetica. And how does that present? It's going to present as tingling, numbness, or even burning of the anterolateral thigh. And last thing you need to know is that the lateral femoral cutaneous nerve would pass below the inguinal ligaments. So that's pretty much it, guys. You have your nerve root, the L2 to L3, and then you have it's a lazy character laying on their lateral side, and they're stuck there forever. So it's a sensory nerve that innervates the lateral anterior portion of the thigh. And then risk factors, pregnancy, pelvic surgery, and then the person wearing tight clothing, they're obese, these are causes of injury. That's it, guys. This is a storyline summary. Repeat this couple times till it sticks in your brain. Thank you for watching and good luck in your exam preps.